The Covera vascular covered stent is indicated for use in hemodialysis patients for the treatment of stenoses in the venous outflow of an arteriovenous AV fistula and at the venous anastomosis of EPTFE or other synthetic AV access grafts. Before starting the procedure, you should ensure you have chosen the appropriately sized Covera vascular covered stent. It is recommended to refer to the instructions for use for specific guidance on appropriate covered stent selection before proceeding. In most cases, the diameter should be 0.5 millimeter to 2 millimeters larger than the reference vessel diameter. In the case of a difference in vessel sizes, for an AV fistula access, utilize the inflow vein diameter. For an AV graft access, utilize the graft diameter. The length of the covered stent should be long enough to cover the area proximal and distal to the lesion. Both ends of the covered stent should extend at least 5 millimeters into the non-diseased segment of the vessel. The delivery system is available in lengths of 80 and 120 centimeters. After removal from the packaging, ensure that the red safety lock on the delivery handle is in the locked position. If the safety lock is in the unlocked position upon removal from packaging, do not use the device and contact your local account representative. Pre-dilate the stenosis with a PTA balloon sized appropriately for the target lesion. Flush the guide wire lumen with sterile saline until fluid exits the tip. Under radiographic guidance, advance the delivery system over the 035 guide wire past the target lesion. Pull back slightly on the entire system to ensure the radiopeg markers on the covered stent are aligned distal and proximal to the target lesion. Next, unlock the safety lock by pulling it back toward the thumb wheels. With your free hand, maintain a stationary hold on the white stability sheath. Hold the stability sheath as close as possible to the introducer without touching the dark brown moving catheter. Remove all slack from the system. Keep the stability sheath relaxed and avoid placing any tension on it. It is important not to touch the dark brown moving catheter during covered stent deployment. Begin deployment by rotating the large thumb wheel backwards. Watch for the distal radiopeg markers to obtain wall apposition. After approximately 15 millimeters of the stent has been deployed, wait several seconds to allow the distal end to fully expand. Ensure the covered stent has wall apposition before completing deployment. Complete deployment of the covered stent with either the large thumb wheel or the small thumb wheel. Deployment is complete when the proximal stent radiopeg markers oppose the vessel wall. Remove the delivery system and post-dilate the covered stent with a PTA balloon catheter sized appropriately so that complete wall apposition is attained. Avoid balloon dilation in the healthy non-stenosed segment of the vein. For a full list of instructions, warnings, and precautions, please refer to the device instructions for use. This demonstration is not intended as a replacement for the full product directions for use. Please consult the Covera vascular covered stent instructions for use for complete product description, instructions for use, as well as all safety-related information, including warnings, precautions, and contraindications.